Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik NIkam, a cardiologist from Houston, Texas. In this presentation, we are going to look at the left ventricular segments and their recognition in parasternal long axis, short axis, two-chamber view, and four-chamber view echocardiographic images. There's a lot of confusion about which particular wall we are looking at when we are talking about like wall motion abnormalities, cardiac enlargement, or segmental akinesis. No matter which modality we use, be it echocardiography, global longitudinal strain, nuclear imaging, CT, MRI, or any other modality that we use, we have the heart divided into a standardized 17 segments as it is shown. And when the heart is compressed from the apex all the way to the base, we get a pancake shape, a target view, which represents the basal segment here. I don't know if you can follow my arrow here. It represents the basal segment here, the mid segment in the middle, and the apex, which is represented here, the basal segments, the mid segments, and the apex. Again, as I said, this is by nuclear cardiography, this is by CT or MRA, and this is the global longitudinal strain. All of these use the same segmentation to represent various segments of the left ventricle. And when it comes to echocardiography, it is more emphasized in terms of what region of the myocardium is moving normally, what region of the myocardium is not moving normally, thus suggesting the presence of ischemia and or myocardial infarction. In this presentation, the focus is going to be on echocardiographic recognition of the various segments of the left ventricle based on various views that we are talking about, namely the parasternal long axis, the short axis, two-chamber and four-chamber views. So let us begin with the orientation of the heart with reference to echocardiographic planes. How the heart is situated in the chest is not just anterior posterior, as most of us would think. The heart is sort of rotated to the left side, and that's why a lot of these views can be confusing when we relate them to these various planes that we are talking about, namely long axis or four-chamber view or short axis. Here is the different views we have. Here we have the parasternal long axis view going through from anterior to posterior region of the heart. Then we have the short axis, which is the easiest one to understand. Then we have the parasternal four-chamber, apical four-chamber views, which is going through the heart right in the middle, like slicing the pie and pear. And then, of course, we have the two-chamber view, which focuses on the left atrium and the left ventricle of the heart. So these are different orientations that are used, namely the four major orientations: the parasternal long, which is this one. Then we have the short axis, which is the easiest one to visualize. Then we have a two-chamber view, which sort of slants towards the left, focusing on the left ventricle and the left atrium. And then we have the apical four-chamber view. Okay, let's look at this. And this is sort of a more easy to understand diagram showing the parasternal long axis here, then the short axis, and of course the apical four-chamber view, which is used for four-chamber and two-chamber views. And here is the classification of the various regions of the myocardium that is represented in various views. Even though the heart looks like it is located anterior posterior, but it is actually the apex is here, so the heart is sitting like this. The heart is sitting like this, not straight down. So that's an important concept to keep in mind. Now let's talk about the long axis. This is from the American Society of Echocardiography. So this has to be the gold standard in terms of recognizing the various chambers of the heart in various planes. When you look at the parasternal long axis, which is this view coming down this way, then we have the anteroseptal and infralateral. What does that mean? So we have the anterior wall, here's the septum. So this plane is not going, even though the transducer looks like it is sitting in front of the chest. Actually, it is sitting somewhere close here because we see the right ventricle, we see the septum, anteroseptal, and then as we come here, it comes towards the infralateral region. And here's maybe take the mid segment, that's the best way to explain. So the parasternal or long axis view is going through the right ventricular wall, anteroseptal region. I hope you can follow my arrow in the middle here, and then the infralateral region. This is a very important aspect to remember because this is most confusing to many people. So if you're looking at the first view, which is the parasternal long axis, think about the anteroseptal. Anteroseptal. You have the right ventricle, you have the anteroseptal area, anteroapical area, anterobasal area, and anteroseptal mid segment and the apical area. And in the bottom we have the infralateral basal segment, infralateral mid segment, and infralateral apical segment. Even they just label it as lateral segment, but in reality it is the infralateral region just by looking at their short axis view. So keep that in mind, and let's go to the four-chamber view, which is an important aspect. In the four-chamber view, as we can see, it is going just like here, cutting through the pie in the middle. Here we have the four-chamber goes something like this, the four-chamber view. So it is going through the septum. Again, the terminology is sort of misleading because here we use the word septum, and here the septum is divided into anteroseptal region and the infroseptal region. So which is the actual septum? That is a question. That's why these terminologies, even by American Society of Echocardiography, is sort of confusing because it doesn't really clarify. So if we have the anterior wall, we have the inferior wall, we have the anteroseptal and infroseptal. So where is the just clearly defined septal region? It's not defined here. Anyway, coming back to, so in a four-chamber view, we are going through the anteroseptal area. So in a four-chamber view, so this is how the four-chamber view comes. Infroseptum and the anterolateral wall. So if you look at the infroseptal area and the anterolateral wall, that's what is defined here. For chamber view, we have infroseptal and anterolateral walls, and their various segments, namely the basal, mid, and apical segments. These are some of the things we need to keep in mind when it comes to two-chamber view. Basically, we are looking at the two-chamber view, which is almost going through straight like this from top to bottom. Then we have the anterior wall and the inferior wall. Here we have the anterior wall and the inferior wall. The main differentiation we want to make is that in a parasternal long axis view, we are not seeing the inferior wall. In fact, we are not seeing the inferior wall. We are seeing the infralateral region because the beam is going this way in parasternal long. And in four-chamber view, the beam is going the other direction from here, infroseptal to anterolateral. Anterolateral versus this one is infralateral. So keep in mind infralateral versus anterolateral. Those are the terminologies we need to keep in mind, especially if you are taking a board exam and they are going to trick you on this one. And if a person has, for example, infroseptal inferior infarction, it may involve the inferior basal region, it may involve the inferior mid segment, it may involve the apex, and also sometimes the anteroapical region, depending upon the location of the infarction. So if you have an anterior infarct from an LAD, then you look for areas involving the anterior wall, anteroseptal area, which means you will be looking in a two-chamber view where you see the anterior wall, and that's where you will see that one. And if you're looking for the septal involvement, you can see that in the parasternal long axis. If it's a circumflex lesion, then generally speaking, this is the circumflex region, and you're generally looking at these two views, namely the four-chamber view, where you see the anterolateral region of the left ventricle. Again, there's a little confusion here as to anterolateral and inferolateral, and where's actually lateral wall, which is used by many other modalities. But the terminology is a little confusing, though not misleading. But if you are doing echocardiography, you need to stick to echocardiography definition. So by echocardiography, this four-chamber view is showing anterolateral and inferoseptal. So remember this diagram, just imprint it in your mind. That should answer most of your questions. This is looking at an expanded view of the same things that I was talking about in terms of when you're looking at parasternal long axis. I keep emphasizing we are looking at anteroseptum and inferolateral in the long axis. If you go back here, if you look at the long axis, we're looking at the inferolateral and anteroseptal region. This is going this way. And in the short axis, again, it's very easy to identify the segments. We have the anterior wall, the inferior wall, and then you can call this one as anteroseptal, inferoseptal, and anterolateral and inferolateral, septal and lateral towards the apex. So here is the orientation of the planes, which is very important to understand. So the parasternal long axis is not coming straight from anterior to posterior. It is coming more medial, involving the anteroseptal region, inferolateral region, whereas the four-chamber view cuts through the inferoseptal and the anterolateral regions. So these are two main things that we need to memorize, because these things apply mostly to echocardiography, because in nuclear, not much emphasis is placed on regional wall motion abnormalities, and similarly, with CT or MRA, we are focused more on evidence of reversible ischemia, scar, or infiltration. Whereas with echocardiography, since we can see these wall motions, the next issue comes up with echocardiography is the lack of endocardial delineation, which makes it extremely difficult to assess the wall motion abnormalities, because we are not seeing the entire thickness of the ventricle or the entire outline of the ventricular wall, and hence using contrast may help us to enhance our ability to recognize regional wall motion abnormalities. And here's some labeling of these various views depending upon two-chamber view. In a two-chamber view, obviously we have the anterior wall and the inferior wall, as I showed you in the short axis, and this is the LV apex. So those are different views. So ladies and gentlemen, you have been watching a presentation on left ventricular segments in parasternal long axis, short axis, two-chamber and four-chamber view echocardiographic images, and how to recognize various segments, so you will be able to label as which segment is involved in terms of paradoxical motion, which you can see in patients with pacemaker, or patients with left bundle branch block, or patients with heart surgery, or you see akinesis or dyskinesis, in fact, for those patients with possible aneurysm. Thank you so much for watching this presentation. I hope this will help you to understand much better and may be able to answer some questions on your echocardiography board. We have more than 300 cardiology lectures. Please do watch them, and please do subscribe to our YouTube channel, and I will see you in the next presentation.